all the blocked ones. What about the hemorrhagic ones?
Yeah. So the most important thing when you're dealing with a bleed within the brain is recognizing if there's an underlying problem with the blood vessels that cause that bleed to happen. If that's the case, then that's something that needs to be secured. And so the most common cause outside of high blood pressure causing a spontaneous hemorrhage in the bleed in an older person is if you actually have an aneurysm or a weakening of one of the arteries of the brain. And there was a time that many of these aneurysms, it was very, very difficult for us to treat. And now we actually have two great ways to treat those things. A whole generation of catheter-based devices that we use to basically fill that aneurysm with coils and block it from the circulation. And there are other times where open surgery is the best option, and you can go in and put a clip on that aneurysm and exclude it from the circulation.
You don't put a new tube in to flow through?
There are very rare situations where we use stents within the brain to either hold the coils in the aneurysm and protect that artery, or a generation of flow diverting devices like the pipeline device, which we put in as a freestanding device to treat certain complex aneurysms. But that's really less than 5% of aneurysm patients.
But like a good carpenter, you have to have those tools available to you for that 1 in 20 that walks in.
No question. Yeah, you're exactly right, that aneurysms vary dramatically based on their size, their location in the brain, their morphology or their shape. And so all of those technical factors go into deciding what's the best way to treat this problem.
So a patient coming in to talk about this might get a diagnostic test called an angiogram.
Right.
Can you explain that just for a moment?
Sure. So that's using catheters to go in, and you put a catheter in the arteries of the neck. They don't go above the level of the neck, and you inject dye and get very nice pictures of the aneurysm or of that weakening. And that angiogram can then inform your doctor about what's the best way to attack this and treat this, and if the aneurysm potentially needs to be treated at all. I think what's so important is that often there's a real emphasis on using the catheters because people are very attracted to the idea of using minimally invasive techniques. But in the same way that these catheter treatments have changed, open surgery has also changed dramatically. And so there was a time where in order to